Hi guys, how you guys doing? Uh, First of all, I want to use this opportunity to appreciate you guys for, of course, for subscribing my YouTube channel, and of course, you are the reason why I'm here. Without you, I don't see any need of me being here, and the reason why I always come out to talk about some of the prevailing and condition that's affecting our society is because of you. Because most of you guys out there, it's not that you don't know what you are doing, but most of the times you are ignorant of some of the actions that you do. Permit me today once again. I will be discussing on what I title the diabetes mellitus among Nigerian population. Diabetes mellitus among Nigerian population. This is our today's topic, and I'm going to dive into today's topic vividly to expatiate or to discuss some of the risk factors and of course some of the signs and symptoms, prevalence and complications of diabetes mellitus. Alright, let's talk about the introduction. Most people are pursuing their daily activities without knowing that they have this condition called diabetes mellitus, because most of the times it comes without symptoms. It's asymptomatic, just like hypertension. And for this reason, most people don't know that they have it. It is in rare cases when someone just have a sudden collapse, or when you visit a hospital for a medical checkup, that you will be diagnosed of having diabetes mellitus. Alright, what is the prevalence of diabetes mellitus globally? According to the International Diabetes Federation, about 537 million adults worldwide have hypertension. That is about 10.5% of the total population globally. And by 2030, according to the International Diabetes Federation, according to the statistics, shows that about 737 million adults worldwide will be having diabetes mellitus. Alright, let's look at the growth of diabetes mellitus. The growth of diabetes mellitus can't be overemphasized because it is growing rapidly. People are coming down with diabetes mellitus on a daily basis, and most people are affected are those living in low and middle income countries like our country Nigeria. Of course, we are in the middle country, and you discover that about 75% or more than 75% of people living with diabetes mellitus globally are those living in low and middle income countries. So it is a global concern that requires urgent intervention so as to educate people out there to be aware or to reduce the risk factors of coming down with diabetes mellitus. Alright, what is diabetes mellitus? When we talk of diabetes mellitus, the word diabetes mellitus comes from the Greek word. The word diabetes, which means fountain, while mellitus means honey. We can define diabetes mellitus as a disease condition in which the level of glucose in the blood is very high. That is the rate at which, or the level of glucose, that is sugar, you call it sugar in the layman understanding. But when the level of glucose in the blood is very high, diabetes is said to occur. Alright, what then is the cause of diabetes mellitus? What then is the cause of diabetes mellitus? Most people out there, they don't know the cause of diabetes mellitus. When asked, what is the cause of diabetes mellitus? People will be saying that when you eat too much sugar, when you consume a lot of sugary foods and all of that. It's not actually the cause of diabetes mellitus, alright? But it can just be a risk factor. That is, it can predispose you to it, but it's not the cause of diabetes mellitus. I just want to clear that misconception, alright? That myth that you already had that schema that you already developed, that sugar, when you are eating too much sugar, you come down with diabetes. No. The level of blood sugar or the level of glucose is regulated by a hormone called insulin. Insulin, a 15 cm long gland lying behind the stomach. That is, when you eat food now, the pancreas will secrete insulin to regulate the level of blood glucose or the level of glucose in the blood. That is, what insulin does is that it will transport excess glucose from the blood to the body cells where it can use for fuel. It can also transport it to store in the liver as glycogen for future use. This is what happened. What happened is that when the pancreas is unable to secrete enough insulin, or the insulin secreted by the pancreas is insufficient, diabetes then result. That is as simple as that. I say that the level of glucose is regulated by a hormone called insulin, which is produced in the pancreas, a 15 cm long gland lying behind the stomach. When an individual eats carbohydrate or when you eat foods, what the insulin does is that it transports this excess glucose from the blood to the body cells where it can use for fuel. That is to say that insulin is, in essence, is the one that holds the key to open the door for glucose to enter into the body cells where it can be used for fuel. Now, when the insulin is no longer there, glucose stays in the blood, and of course, the already stored glucose in the liver, known as glycogen, will be released in the blood. Now, there's excess of glucose in the blood. Now, diabetes then results. Alright, this is the cause of diabetes mellitus. Don't be confused, or someone shouldn't convince you that when you eat or when you consume a lot of excess sugar, you come down with diabetes mellitus. No, it can only predispose you to it. Alright, let's look at the types of diabetes mellitus. Alright, we have basically 3 types of diabetes mellitus, but there are basic two types that we normally consider them as types of diabetes. The other one is just for temporary. Okay, now we have what is called type 1 or insulin dependent diabetes. Type 1 or insulin dependent diabetes. Alright, in this type of diabetes, it normally affects children below the age of 35 years and with defect in their pancreas. That is, people below the age of 35 years are normally the kind of people that come down with type 1 or insulin dependent diabetes. Why? Because they are unable to produce insulin in their pancreas. So normally what they do is that they are basically placed on insulin evenly all day because of their defect in their pancreas. That is, their pancreas cannot produce insulin. Alright, so that belongs to the type of diabetes known as type 1 or insulin dependent diabetes. Okay, number 2 is called type 2 or non-insulin dependent diabetes. Type 2 or non-insulin dependent diabetes. In type 2 or non-insulin dependent diabetes, it affects people above the age of 35 years. Yes, it affects people above the age of 35 years. In this type of diabetes, they produce insulin. Alright, they produce insulin, but it is inadequate and ineffectively utilized. They produce it quite okay, but it is not enough to utilize the level of glucose in the blood. So this type of people, of course, medically, they are being advised to lose weight or to watch the kind of food they eat. That alone can bring down the level of glucose in the blood. Now, type 3 type of diabetes is called gestational diabetes. Gestational diabetes. In this type of diabetes, alright, it affects pregnant women. That is, women who are pregnant. If I type that, there are women that when they are pregnant, their glucose in the blood will be very high, due to hormonal fluctuation, But once they deliver, glucose now go back to normal. We call that type of diabetes gestational diabetes. Although This category of people, or this category of women, they are at higher risk of coming down with diabetes mellitus in their future. All right, let's talk about the risk. The risk factors of diabetes mellitus. Risk factors of diabetes mellitus. All right, what are the risk factors of diabetes mellitus? The major risk factor of diabetes mellitus is what is called heredity. Heredity. That is, diabetes runs in families. Diabetes runs in families. All right. If a type that comes from a family history of diabetes, you are at a higher risk of coming down with diabetes. That is, for example, if your father or your mother had diabetes mellitus in the past, you are more likely to come down with diabetes mellitus. So people whose parents have diabetes mellitus in the past are advised to be on the lookout for their risk factors of diabetes mellitus. All right. Number 2 risk factor is called obesity. All right, obesity. People who are too fat, people who are obese, are also at higher risk of coming down with diabetes mellitus. If you are a kind that is obese, or if you are a kind that consume a lot of food, especially those who are obese or those who are overweight, you are advised to be on the lookout on your weight reduction. All right. Another risk factor is called the kind of food you eat. All right. If you're a kind that eats anyhow food, like sugary fruits, like pineapple, anyhow peanut, banana, consume a lot of sugar, but it is not a cause of diabetes mellitus. It will only predisposes you to it. So my advice is that you should be on the lookout on the kind of food you eat, and I'm not saying that you should not eat sugary fruits, but know the quantity that you consume. All right, let's talk about the signs and symptoms of diabetes mellitus. What are the signs and symptoms of diabetes mellitus? What are the things that you'll be experiencing that you know that you are having diabetes mellitus? Most people who are pursuing their daily activities are unaware that they have this condition, and of which it is in their body system, because most of them, they are asymptomatic. But some of the signs and symptoms include: 1, excess urination. You'll be urinating frequently, excess urination. Nocturia. When you are sleeping in the night, you discover that you'll be going out to urinate, more than 5 times in the night. Excessive consumption of food. You'll be eating a lot of food as compared to like before, like as in the kind of food you eat will not be the same at the level at which you eat before. Cramps, itching of the body, including the private part. You discover that your body will be itching you, and even your private part. Maybe you are a woman or you are, a man. Discover that you'll be scratching your private part, and all those reproductive organs. Another signs and symptoms include ants crowding around the urine. You discover that when you micturate or when you urinate, you discover that you see ants will be crowding around the urine. Why? Because there is sugar in the urine, so they are coming to feed on it. All right, ants crowding around the urine. Another signs and symptoms include a family history of diabetes. All right, another sign includes that is you'll be having if you're a man, you discover that your libido will decrease. You'll not be having feelings to have sex again. Your libido will begin to decrease. And other signs and symptoms, etc., etc. All right, let's look at the medical management of diabetes mellitus. What are the medical management of diabetes mellitus? The goal of the medical management, although we have about 2 categories or 2 to 3 categories of medical management of diabetes mellitus. The first medical management is called nutritional management of diabetes mellitus. That is, people are advised to refrain on the kind of food they eat, to refrain on their lifestyles. Lifestyle modification alone can contribute to bring down the level of glucose in the blood, and that alone can be satisfactorily control glucose in the blood. However, there are some people that they are advised to refrain on the kind of food they eat. If you type that consume excessive, maybe like carbohydrate, you are advised to refrain on the kind of food you eat. For example, yam, food, any food that contains carbohydrate. Although there are some food that carbohydrate is being replaced in moderate quantity, of which a nutritionist or dietitian will recommend you to go for it. Alright, so lifestyle modification alone can achieve glucose control. Weight reduction. If I type that is obese, you are advised to lose weight. You are advised to look on your weight so as to bring down the level of fat in the body and to decrease the level of glucose in the blood. Alright, now the kind of food you eat, just like I earlier mentioned, you'll be advised, you'll be placed on special diet. Alright, if I type that eat banana, eat pineapple, eat sugar or sweets, you'll be restrained from them, right? So that you avoid coming down with hyperglycemia. When we talk of hyperglycemia, we refer to when the level of glucose in the blood is very high and it's very, very dangerous to the body system or for your health. Alright, now that is for nutritional management of diabetes mellitus. Now pharmacological management. In pharmacological management, there are different classes of drugs used in the management of diabetes mellitus. Alright, that is in type 1 diabetes mellitus. Patients or people are advised, or patients are placed on insulin even all day because they have defect in their pancreas. That is, their pancreas cannot produce insulin to regulate the level of glucose in the blood. So that is why they are placed on insulin even all day. There was this question that one of my clients asked me, that is it that insulin should be given to people with diabetes every day for the rest of their life? No, insulin cannot be given to people with diabetes every day for the rest of their life. It will come to a point whereby if they notice that your level of glucose is regulated or is maintained, the physician or healthcare professional will advise you to, for now, that you should stop taking insulin pending when there's a need for it again. But that does not mean that you are advised to stop completely. No. One thing I want you to know that diabetes mellitus is a chronic disease. It cannot be cured, alright? It cannot be cured, but it can be managed. That is why when there is poorly managed diabetes mellitus, there's a lot of complications that can set in. And when you overwork yourself, when you expose yourself to excess, consumption of, weight or of work, you are predisposing yourself to coming down with complication. One of the physicians writing on occupation and high blood pressure and diabetes mellitus had this thing to say some time ago, that a man or woman who work himself to cracking points owing to the misguided belief that he or she is an indispensable deceives himself, and he is suffering from engortism, and he or she dies or is crippled with the strain of overwork. He has himself to be blamed. Whether he like it or not, the work will go on in spite of him. So in pharmacological management, we have different drugs used in the management of diabetes mellitus. Although I'm not going to talk about the drug used in medical management because I don't want people to go for self-medication, which is not right. If you are having issue, or if you know that you have this symptom, visit a health facility for medical management of diabetes mellitus. Because self-medication is not advisable for your health and for yourself. Alright, so please share this video to save life, because there's a lot of people out there, they are moving around the streets who have this diabetes mellitus and they are unaware of some of the signs and symptoms, and they don't know that they have this condition. Please share this video. Who knows, you might be saving lives. Alright, let us go into the preventive measures of hypertension. But before I talk about preventive measures, first of all, I will talk about the complications of diabetes mellitus. What are the complications of diabetes mellitus? There are different complications of diabetes mellitus. One, we have what is called hypertension. Alright, when there's poorly managed diabetes mellitus, it affects blood vessels. That is, the blood vessels supplying vital organs will be clogged with different cholesterol. That is, they will be clogged, and then they'll be narrow. So the rate or the flow of blood to the whole body system will be diminished. Alright, so hypertension is one of the major complications of diabetes mellitus. Alright, another complication is what is called kidney failure. Kidney failure. Alright, you have kidney failure, and kidney failure is a poorly managed diabetes mellitus. It's a complication of diabetes mellitus. That is when you manage your diabetes mellitus in a poorly format, it affects kidney. Alright, another complication is called retinopathy. Retinopathy. When we talk of retinopathy, we are referring to, that is, the blood vessel supplying the retina of the eye will be blocked, and that will bring about blindness of the eyes. It's covered that the person will be having glaucoma, and the person will not be seeing again. So retinopathy or blindness is one of the complications of diabetes mellitus. And then another complication is what is called arteriosclerosis. Arteriosclerosis. And when there is arteriosclerosis affecting the lower feet, it will cause what is called gangrene. When we talk of gangrene, we mean that is the blood vessel supplying the lower feet or the lower limb of the feet will be deprived of blood and oxygen, and then there is lack of oxygen and nutrients to the lower feet, and then the lower feet will be affected, and then they will become dead. So amputation may not result. That is why I discovered that people who have diabetes mellitus, they say that they are going for amputation. That is, they will cut one of their feet or one of their leg because of this condition known as diabetes mellitus. Alright, let's talk about the preventive measures of diabetes mellitus. Preventive measure. The major preventive measures of diabetes mellitus is what is called routine medical checkup. Routine medical checkup. If you are a kind that doesn't visit, it is advisable that you should visit the hospital at least to check your level of glucose in the blood at least. That is, we have two types of diabetes tests of that. We have RBS and FBS. We'll talk about RBS, that is random blood sugar